Give me a minute. I'm giving you the part 3 link now. All right. Apologize for starting late. So the reward will be, I'm giving you the link now. All right. You can look at it later. Perhaps at the end, I will try to post all the 3 links again. Okay, part 2. You scroll up your comments. You scroll up to the comments above. You can find all the links. Part 1, part 2. Scroll up. All right. So I have been asked to start. I will start now. All right. Today is an easy session, easy session, but I will do a little bit of revision as I promised, and because some of you have missed out part 1, right? So, what are the misconceptions about Tung style acupuncture? The major misconception. One of the conception is there are many who says Tung acupuncture is only for pain management, all right? Or it only treats symptomatically, all right? It doesn't go into any analysis or no root cause. This is a major misconception that it is only useful for muscle skeletal pain, right? This is not true because Tung acupuncture is very useful for cardiovascular, is very good for infertility, digestive, okay? It can be used for stroke. It can help to manage even cancer, all right? So it is wrong to say Tung is only for pain management. But it is really very good for pain management. So in a way, it's a compliment that we are good at pain management. If you run a clinic, more than 50% of your cases are pain management cases. So in order to run a successful clinic, and if you can do pain management, you can pay your expenses. You can pay your badra, okay. You can pay expenses, all right? You can pay rent. If you know how to do knee pain, you can pay rent. Okay, if you can do frozen shoulder, you can buy a car. Okay, it's something like this. Pain management is not what Tung only can do, but it is realistically a very good tool to use. Tung, all right. Number 2, Tung ignore traditional Chinese medicine theory. Okay, this is another misconception. Tung does not ignore traditional Chinese medicine theory. It comes from classical medicine theory. Okay, so in reality, Master Tung acupuncture aligns deeply with classical Chinese medicine, which I will repeat in a while. Principles, especially channel theory, yin yang theory, and 5-element theory. Actually, they are all inside Tung. Only it is applied in slightly different way. Okay, just because Master Tung does not use the same numbering system, does not say stomach 36 or LI4. So many things that think that it is not Chinese medicine. Okay, that is really, really very far from the truth. Another misconception is you must abandon TCM to learn Tung style, right? So this is not true. Okay, some says that you must choose either one. But in reality, skills acupuncturists blend Master Tung method with the 14 channel, all right? And drawing on the strengths of both. In fact, the synergy or the combination of the two systems often leads to a more superior acupuncturist. Okay, this is a bit of a repetition. Okay, look at the large intestine and you find that you have large intestine TCM points, Li5, 6, 7, 8. But Tung found that there are points in between them, in between. All right. Now, when you add points to the large intestine channel, it doesn't mean that you have weakened TCM. No. In fact, you have made TCM more powerful. To me, you have made TCM channel more interesting because you have added points on that line. I cannot imagine that there are no more points. Even if Tung have added points on the large intestine, I'm sure that there are other points also on this large intestine. All right, and there is also a current theory that says acupuncture is not about point. It's a wrong concept, which I agree. The name acupuncture means needle a point. I think it's not it's not true. It is we stimulate a line. It's a line action. It's a line, all right? Different body anatomy. The point is not accurate. It's not accurate, all right? It's don't lose the line. If you cannot remember where's the point, okay, but don't forget the line, right? So another beautiful thing about Tung is we have points in between two channels, something which TCM does not have. 77, 22, and 23 is one of the most commonly used point. It is 72, 77, 22, 23. It works like GB34. All right. Anything tendonitis, muscle and tendon paralysis, facial paralysis, all right? It is this point, 77, 22, 23, and it is sitting in between the gallbladder meridian and the stomach meridian. It's right in the middle. All right, two beautiful and very commonly used yang meridian are the stomach meridian and the gallbladder meridian. And you have 22, 23 sitting in between these two meridian, and it has the indications of two meridian. Of course, the dedicated TCM practitioner might say, oh, no such thing and so on and so forth. But I think we are broad-minded enough to accept that perhaps it is true. There are points. There is another line, although there's no name, in between two channels. So this is also very common in Tung, having points in between two channels. So this is what I mean by Tung making TCM more beautiful, more interesting, more powerful, more beautiful. So a bit of repeat of session one. Yeah, somebody asked for all three parts. I will post it at the end. Today is going to be a easy, short session. All right. We will try to have more question and answers. So Tung returns to the classical roots. It doesn't even say itself as traditional. It say that it is classical. Classical means it's slightly even earlier than the usual traditional medicine. So in reality, Tung originates from the oldest of Chinese classics. the I Ching. I Ching is one of the oldest written the books, all right? And the I Ching and the Bagua diagram, all right? As I say, this is a symbol of the I Ching, the Bagua. And you will see it in all Chinese ancient uh, structures, temples, or home. So the Bagua is a system of 8 symbols or trigrams. These trigrams represent natural forces like heaven, earth, water, fire, mountain, wind, thunder, and lake. Each trigram represents a natural phenomena, a direction, a body part, a emotion, a season, a physiological function. They are arranged in a circular pattern and they show how qi flows and transforms. So yin yang comes from the Bagua, all right? The five element comes from the Bagua. Tung imaging, left versus right, up versus down, heaven versus earth. These are all Bagua's classical theories. Even the so-called modern Dr. Tan balance method is from the Bagua. Abdominal acupuncture. The whole entire Bagua diagram is fitted on the abdomen, all right? Scalp acupuncture, all right? There are many types of scalp acupuncture. Okay, there's a Bagua scalp acupuncture, which is used. I don't practice, but it originates from the Bagua. Qi Gong exercise, Tai Chi, is from the Bagua. And those of you who have heard of the word feng shui means you arrange your house in a northerly or southerly direction. Your bed must be on the west side. Your window must face the sun, blah, blah, blah. They are all Bagua theories. And that's where ancient knowledge and TCM and Tung all comes from the Bagua. That is why you can use them, okay? You can use them together with a lot of success. All right. So I'm just trying to cover the misconception. Before I go to part 3, which I feel is simple. Oh, can you make the slide full screen? Oh, sorry. All right. Sorry, I read that a bit late. I can take some questions over those who have attended part 1 and part 2. Any questions? All right, maybe I will carry on and you can let me have the questions later. All right. So today's session, I have picked 10 common disorders, 10 common disorders, and show you how, you know, I think these slides can be useful, all right? It's used for teaching, but it can be useful in the clinic, all right? So I've just shown you, I will show you how TCM practitioners treat some of these, all right? Just like a sample of the points, all right? And I will show you how Tung practitioner treat the illness I have extracted the information from my 2 books, all right, uh, which you will get if you attend the course. TCM, migraine, all right. All of you know what is migraine, isn't it? Migraine, more at the side, migraine, very, very stubborn, all right. Migraine is very stubborn. So what are the points that you would use for migraine, TCM? Number 1 point, I think, is GB20. Yeah, sometimes even one needle, it can work for GB20. And GB34. GB34 because muscle and tendon. All right. I don't intend to go very deep into, you know, the reasons behind the points, because these are all what you have learned in TCM or you find in TCM clinical books. But I think it's helpful even for TCM practitioners, this slide. Okay, Sanjiao 5, Li4, of course. Uh, Everybody says that Li4 is for all headaches. Sometimes it works, sometimes it doesn't work. All right. Taiyang, of course. Taiyang. So typically, this is how a TCM acupuncturist will handle migraine. So a Tung practitioner, all right, a Tung practitioner will use T77, 22, 23. This is the point that I mentioned earlier, in between the gallbladder meridian and the stomach meridian, all right? And we will use 8825, which happens to be GB31, GB31. And we would use bloodletting. Okay, bloodletting, ear apex, that's my favorite. Anything connected to the eyes or eyes or headache, I would bleed the ear. The advantage of using distal acupuncture, see, these are distal. You notice the points are not at the head. That is a feature of Tung. We do not treat where the pain is. So once you put these points, 77, 22, 23, or 88, 25, you then ask to maybe the patient to like massage his pain area, move, do some what is called active chi moving, make the patient, like twist his or her neck, this is how to encourage the chi to go to the affected area. Okay, these are the things we have discussed yesterday. So that's migraine, and this is a chart that combines these two systems. When do you use Tung and when you use TCM? All right, this is really up to you. Up to you. Up to you. You can use Monday one system, Wednesday another system, or sometimes you can combine the two system into one sitting. All right. Of course, if you put the needles at the pain area, you then cannot do the active chi moving. So this is now the art of acupuncture. All right, the art means it's up to you. You have to decide. All right, it doesn't mean you use all the point. All right, you are going to disperse the energy if you use all the point. All right, maybe use 4, 5. No, if it doesn't work, You can add on another 1 or 2, and if it doesn't work again, you add one more. And if it doesn't work again, then you remove all the needles and start all over again. Low back pain, all right? Low back pain. So typically, these are the points a TCM practitioner will use. I'm sure you will enjoy going through all this. You'll be helpful. I hope so. Okay, BL23. So you can notice these are local acupuncture. These are needling the pain area. When you needle the pain area, you cannot ask the patient to take a walk. All right. Okay, BL40. You can moxa, you can cup. These are good for TCM style for low back pain. For those who are talking about the book, there's a question about the book. You get the book free if you attend class. If you want to buy the book, you don't attend class, you want to buy the book, then go to Amazon India. all right, go to Amazon India. I think there's a small promotion going on. You can buy the book. You look under Tung Acupuncture, or you use my name, Visudi Lee, you will find the book. So this is how a Tung practitioner will not put needles at the pain area. So here, all right, on the small intestine meridian. Don't worry that you don't understand. Just have a feel that, oh, this is how a Tung practitioner works. Okay, if you can feel that, then I would have been successful with all this Zoom session. Why I'm doing the Zoom session? I'm just trying to show that there's another way, there's another school, there's another fighting technique which will blend with our current system. 220405, of course, is very popular. And of course, we will bleed any veins showing at the BL40. This is my favorite. My favorite, if I have an option to bleed, I will always bleed first. So this is another characteristics of a Tung doctor. He likes to bleed. We are vampires, all right? We love to see juicy capillaries because our experience tells us that that is the most effective way to solve a patient's problem. Whenever we use bloodletting, the patient doesn't need to come to us so often. All right. In fact, they save some money. You use acupuncture to treat certain cases. The patient needs to come for a minimum 6 times, 8 times, 10 times. In China, if you go for acupuncture treatment, they actually mean come 10 times. Okay, this is not so in India or even in Malaysia. All right, our patient want to get better in one treatment. All right, in China, everybody knows if you use needling is about 10 times, 10 times for one cycle. If it doesn't work, they might go for a second cycle, another 10. But if you do bloodletting, you don't follow this rule anymore. Bloodletting can solve cases in, sometimes one, sometimes many times in one session. Okay, so this is a combination of low back pain. Okay, there's nothing new in this slide. It just combined the earlier two slides. Insomnia, of course, treat the heart. Heart. When you want to treat emotional issues, you look at the heart meridian. When you want to treat the physical heart, you treat the pericardium. All right. You don't use the heart meridian for physical heart. For emotional, yes, heart 7, spleen 6, and of course, our favorite DU20. This is good points. All right. And Tung system, okay, we also use a 10-10-08, which I think is the yin tang, okay, similar to yin tang. We are a little bit above yin tang, but I think it's the same. And we have 11-17, which is for anger. Anger. Those who come into your clinic and they complain, no aircon, or why your price is too high, and they look at, and they are angry. The angry patients, you treat the liver. And this 11-17 is Tung's number one point to treat emotional liver. What you call liver yang rising. And you can treat 77-18. 18 is a kidney point. All right. Okay. That's insomnia. So this combines the two systems. Jaw pain, all right? Jaw pain, local treatment. Local. Try not to use electrical stimulation. Sometimes it make it worse. Sometimes it make it worse, all right? Do cupping, dry cupping, but must be gentle. Must be gentle when it comes to nerve type of issue. If you disturb it too much, you might aggravate the situation. And this don't happen if you use distal acupuncture. This don't happen if you use Li4. All right, Li4 for jaw pain, you will not make it worse. All right. My policy about running a clinic is not necessary to heal the patient, but more don't make him worse. The number one priority is don't make the patient worse. Tung treatment point. Tung treatment point, 77, 22, 23. All right. So this is a distal treatment. Once you put this needle, 22, 23, you then ask the patient to open and close his jaw and rotate the jaw, okay, to help to bring the chi to that section. And 660403, the liver meridian. All right. And then you can do cupping. I'm sure you're comfortable because these slides are going to be with you. All right. These are given to you. Number 5, knee pain. Okay. So knee pain, the what you call the favorite 3-point. 3-point, I forgot. I went in TCM school. What do you call it? The knee point, the 3 knee points around the knee and electrical stimulation. All right. And of course, GB34, spleen 9, all around the knee. This would typically be how a TCM practitioner might treat the knee. Please don't misunderstand that there are no other points. Okay, there are other points. The TCM has many approaches towards knee pain. A Tung practitioner will use Li 11, 1109, 13, and also many others. Right? Knee is not straightforward. It's not. You have to look at whether the knee is on the medial side, on the lateral side. You have to look whether it is on the posterior, anterior. All right. And if the patient is walking up the steps, is worse off, or down the steps is worse off. All right. So this is knee pain. This is the combined treatment for knee pain. Then you have facial paralysis. Again, generally, you find needles on the pain side. All right, pain side. Pain side with some electrical stimulation. Again, my recommendation is be gentle on electrical stimulation. Be gentle. What you do is when the patient come, you just do very light electrical stimulation, very light, right? The lightest. And if the patient comes again and he says, I'm getting better, then you can increase the stimulation if you want to, all right? But if the patient comes and say, I've been suffering since I came to you, then you know that the electrical stimulation will not help. You have to just put the needle in. Tung treatment, remember, Tung treatment is always on the opposite side. It's not only distal, but it's opposite side, all right? You can use GB34, but use it on the opposite side. A TCM practitioner will generally use it on the same side. If it works, fine. If it works, fine, carry on. If it doesn't work, put it on the opposite side, right? And 7705, all these are very good points. 7705 and 7 is again in between stomach and gallbladder meridian, in between the two lines. And when it comes to cupping, face cupping, you also have to be very gentle. Very gentle. Sorry, paralysis, no, not necessary. Not necessary to be gentle because it is not a nerve trauma. Okay? Okay, the nerves are affected, but it's not like an injury. So you do not cup the opposite side of pain. No, you cup the same side. Just like bleeding. Bleeding, cupping, guasa is on the same side as pain. Needling is on the opposite side. Somebody asked whether we can cure rheumatoid arthritis. Of course, Tung acupuncture cures the whole range of diseases like in TCM. All right. Sciatica, all right, sciatica. Of course, number one is GB30. GB30, remember. That's how I learned it in TCM school. DU20, GB30, BL40, BL60. 20, 30, 40, 60. And I'm sure many of us have gone through that school. A Tung practitioner, he will put that put at the palm, at the hand, 2204, 2205. This combination is Tung, in a way, most often used combination, 2205 and 2204, right? It moves blood throughout the body. So this is for Tung. This is Tung combination. Number 8, tinnitus. Tinnitus. I think one of the most difficult disorder is tinnitus. Tinnitus. Okay. Most books, most teachers, most experts will tell you tinnitus is not easy to treat, right? Maybe there's an element of old age in tinnitus. All right, we do not know. Anything connected to old age is difficult to treat because it is not a disorder. Growing old is not a disorder. So, but tinnitus, if you want to try, these are the points to try. Do try, do try, yeah? Because it is a very traumatic situation for patients who keep on, you know, hearing unnecessary sound. It drives you crazy. So this is Tung. Again, have you seen how many times 77, 22, 23 appear? All right. Okay. It is by the side of the leg, GB34, GB34, muscle and tendon. And because of the fascia pain, the side treats the side, all at the side. The side treats the side. This 77, 22, 23 will treat the side up to the hand, all right? Okay, here, the entire area, okay? Is can be treated with 77, 22, 23. 77, 18 is a kidney point. It is a point with Tung practitioners, those of you who are here. Anytime you find an elderly patient, above maybe 50 years old, appear weak, weak. Disregard what he came in for. Please put in 77, 18. All right. This is our kidney point for elderly. A person elderly with headache, you put in 77, 18. All right. And of course, bloodletting behind the ear. Dysmenorrhea, all right? Menses pain, abdominal pain, menses, all right? Menses. Okay, okay. These are the spleen 6, of course. Spleen 6 is TCM gynecological point. Anything connected with gynecology, you can use spleen 6. Liver 3 moves the blood. Liver 3 moves the blood. RAN 4, all right? RAN 4. Right? You can moxa this area. Moxa this area and moxa the back where the pain is. Moxa the pain area at the back of the patient. Stomach meridian, use point on stomach meridian to treat. This is how a Tung practitioner will treat. Again, you can see the nature. We practice distal acupuncture. Is drawing lines all over the screen. Must be me, is it? Okay. The last disorder, chronic fatigue. Of course, stomach 36. All right. Moxa, stomach 36. This is for long life. make sure you moxa your parents' stomach 36 twice a week. Okay, only 5 minutes. Okay, this is one of the long life protocol. It gives energy, spleen 6 and DU20 for chronic fatigue. For Tung acupuncture, you treat, of course, the lung. This is our lung protocol, 8817. More oxygen to the blood is 8817. And of course, as I mentioned, the kidney point, 7718, right? So for those of you who are unfamiliar with Tung, all right, that's because you have not attended a Tung class, all right? And my purpose of coming to India, and I'm going to 4 cities in June, is to teach the Tung system. Many of the things that I've said in part 1, part 2, part 3 is lectured on the first day of the 3-day course. Okay. For those who can make it, I would love to meet you. I would love to make you a stronger acupuncturist. And these 2 books will be given, and those who register up to tonight, I will give you the digital version. What is worth 4,000 rupees, My books are also worth 4,000, the digital also 4,000. All right. But I hope Vamsi will be strict with this. Those who take the trouble to register early, we should reward them. All right. Okay, I'm ready for questions. I'm ready. Can you show bloodletting also? How to show bloodletting? One of my patients suffering from wrist pain on both the joints, radiating to thumb. What will be Tung treatment? Okay. A very quick way, for those of you who are interested, of course, you need to come to class to get the full treatment. But for those who want to try, if you have a wrist pain on the right hand, locate where it is, wrist pain. You go to the left hand, exactly mirroring the system, mirroring the wrist, all right? And near the mirroring point, if you find there's an ashi, put the needle there, all right? So this is a good wrist pain, a quick without going into the book. All right. Then you have time, you have to open the book and look under the chapter wrist pain. 1127 for Tung practitioners, you can use. Can you share first and second days? Yeah, I'm going to give you all the slides. All right. All right. If you want the I'm suffering from severe sinusitis. Tried many Tung point. Can you please suggest correct point? You have to tell me what point did you use in Tung. All right. Maybe you are already using the correct points. Sometimes we use the correct points, but our insertion is not deep enough. Okay. This is the sinusitis point. Okay. I mix between Tung and TCM. Sometimes I couldn't be bothered whether I'm using Tung or I use TCM, but we just want to make sure it works. There's someone without an TCM degree can attend this class and practice. My sister very much. She has come. Yeah, you can come. I prefer you to have some needling experience, but every time I come to India, I will have 1/3 of the class. They have not even held a needle. 1/3 of participants have not even held a needle. But why I take on these students is because from my experience, these students who have got no prior acupuncture experience, sometimes they are the fastest learner. All right. They progress very well. How often can we bleed ear apex? Once in 10 days? Infertility, Tung point infertility, 1106 and 1124. 11:06 on one hand, 11:24 on the other hand, and you rotate. All right. Get them to come 3 times a week. Maybe the one with the sinusitis, maybe use the guasa and do like anti-aging guasa all over your face. Okay, not bleeding, huh? Not the normal bleeding mark. This is called anti-aging. This is stimulation of the entire face. Or use the cupping. Use the cup. Okay, since your needling doesn't work, you have to try other methods, all right, for your sinusitis. Do you think any system can cure diabetes? I don't think so. I don't think so. I don't think TCM can cure, Sujok can cure, Sometimes we manage. We only manage diabetes. Why? Because diabetes is a lifestyle problem. It's lifestyle. You put in the needles, okay, but you are advising him on the lifestyle. If you can advise him on lifestyle and diet, and then you put the needles, he will think the needles are working. Doesn't matter as long as he get better. Those who are attending training, yeah, those who are attending training gets hard copy. You get hard copy of the books. Any points for hair fall? Hair fall, plum blossom, tap, 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 every day. Tapping, 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 and put the kidney points. Use tongue diagnosis, you can use pulse, you can, you can use climate or all the TCM. You can use those diagnoses and then use Tung points here. But strictly Tung is very much easier. We use what is called a palm diagnosis, right? And we because maybe it's a bit the teachers are a bit modern. We can even talk in terms of allopathic language, all right, to treat using. So use whatever you have. But if your 5 element theory says that the kidney is weak, if your pulse says the kidney is weak, then needle the kidney point in Tung 7718. All right. Ooh, autoimmune, SLE, lupus, fibromyalgia. Even I'm having trouble with this. All right. All right. So no straight answer. You to have more tools. If you know TCM, fantastic. You know Tung, fantastic. You know Sujo, even better. You learn Marma, fantastic. All right. Uh, so these are all stimulation. And then you use bloodletting, guasa, all right, guasa, the scraping, all right, this is my favorite, all right. 20% of the time I will be using guasa and then I put in a needle, okay, in the distal. I guasa the local area, I needle the distal area. Okay, this is my combo treatment. Shoulder ligament tear, I do not know. Maybe surgery, all right? Anything whereby the pathology has broken, you must consider surgery, all right? Not all the time acupuncture will work. All right, all right. You know, I'm getting old, Seldom am I tired. 3 nights in a row, okay, but I'm really happy. Maybe I've been resting too long, 1 year not teaching. So I'm looking forward to June. uh, Starting with Mumbai, and I hope to see you all there. Um, if you're interested, please register early. That will help Dr. Vamsi, who is my uh, coordinator. Don't give him too much trouble. He's a very nice guy. Uh, uh, Okay. Looks like everybody is happy. Happy,
Hello.
happy. Vamsi, happy? Points to lose weight. There's no points to lose. Of course, there are points to lose weight. They are, you needle, but it's a lifestyle problem. Okay. Don't say you don't treat, you treat. All right. But then you must be good at giving lifestyle and diet uh, points. All right. If you come for training, I will be giving you slides, which also have Chinese herbal medicine. I will not teach you, but I will give you the slides for herbal medicine. So this is a bonus for those who come for treatment. All right. Yeah. Actually, the slides are all brand new. I've redesigned the lecture notes so that those who come to repeat will not find it too boring. All right. But be prepared to work very hard. Be prepared to work very hard. There's going to be a lot of material for 3 days. All right. It's something like supposed to be 10 days course. I'm putting it in 3 days. But all of you have been always very hardworking. So I'm points for gain weight. I don't know. Points for gain weight. Interesting. Actually, when you have a patient like this, when the patient comes to you and say, I want to put on weight, I want to put on weight, all right? Don't think of that complaint. Don't think that, oh, the patient want to put on weight. No, you try to study the patient. You try to talk and you find out his life. What work does he do? You know, what other symptoms does he have? And then suddenly he might tell you, oh yeah, by the way, I got insomnia. Maybe it's the insomnia that is causing him to lose weight. Then you treat insomnia points. All right. This is how you must know the patient in a more complete form. All right? If you just treat one symptom, all right, one symptom, I don't think you'll do well. All right. He might come for that symptom, but actually there's something else wrong with him, which he's not telling you. So it's up to you to find out. Oh, slide link, slide link. Yes, yes, yes. I got to get that link to you. Uh, um, I must get the link to you. I'm having problem with this. Okay, give me a second. I got to stop sharing. I got to stop sharing. Give me a minute. I'm going to give you, try to give you all the links in one go. Okay, I'm posting the link for today. Why is it not? Oh, it's saying, okay, this is the link for today. And I'm going to give you the link for part 1 now. Part 1 coming. And part 2. All right, so part 1, 2, 3 is all there now. All right.
So 3 days class links has been shared. The slide links you can copy. You can copy now.
Please
So
copy. Yes.
you can copy 3 days links. Lisa had what he said he had done. So friends, once again, I'm repeating the upcoming classes. Many people are asking. So Mumbai, it will be 6th, 7th and 8th. Bangalore, it will be 13th, 14th and 15th. The slide is there. You can check on 20, 21 and 23. So I request who want to registered immediately to not overcome the rush. So yesterday, today, many people had registered. So you can check. The dates are there. So in this class, again, you are getting 4,000 worthable live copy of the books of Master Lisa, which had been written by him. So the course content is there. So you can check anything, any doubts regarding the classes, you can call me at or WhatsApp me at any time. So early bird offer, we are closing soon. I think so. Tomorrow we will keep, and next the early bird offer will be closing. So then you have to pay 15. So try to think. So it will be very much useful class. So any doubts regarding the class, you can contact me on my WhatsApp number is there. So the course content also you can check. 3 days will be very much uh, useful class.
Anyway, I really like to thank every one of you, every one of you for joining especially if you have stayed up for the last 3 days. All right. We have got some of my very good Malaysian doctors here. We have got Mona from Australia. Maybe you all should switch on your camera. I would love to see you all. Yeah, switch on your camera. Yeah. Okay, very good. Okay. Thank you, everybody. Thank you. Shall we say good night?
Yes, sir. Yes, sir. Any doubts, you can call. You can ask. We
No
will close, sir. No problem.
problem. Yeah, good. Bye, everybody.
Thank you to all. So please come to the upcoming class and utilize this Lisa knowledge. Thank you.
Mona, switch on your camera. Is Mona here? Mona here? Oh, serious. It's too late. Ah, it is 1 a.m. for you. 1 a.m. Am I right? Yeah, 1 a.m.
Hi, Mona.
Switch on. Switch on your audio. Switch on your audio. Mona is from Sydney.
Australia.
Sydney.
Australia.
Where's your husband? Asleep?
Yes, very much
He's
so.
asleep.
Asleep, that's right.
Otherwise, I was hoping to see him. You are already in your pajamas.
Yes.
Okay,
put the alarm. Put the alarm to wake up.
you have stayed for 3 whole sessions. Thank you very much.
Yes, thank you.
Okay.
Thank you very much. Thank you.
All the best. Okay.
All the
give your
best to
husband
Mimi.
yeah. Give your husband a special kiss for me. Okay.
Yeah.
Say it's from Dr. Lee. All right.
I will. I hope you
Okay,
come
then.
to Sydney soon. Okay.
Yeah. I will come to Sydney. Okay then.
Okay. Bye. Thank you.
Okay then. Sridhar Balakrishna. Okay then.